Okay, good day everyone. My name is Sina Babazadeh. I'm an orthopedic surgeon working at St. Vincent's Hospital, and my talk today is about the trials and tribulations of setting up a registry. So why a registry? In this particular case, I'm sure you all know that we put metal into people. Sometimes that gets infected, and it's a disaster when it does. Fortunately, infections in joint replacement are a rare event overall, but unfortunately, they're heterogeneous in terms of their presentation and management. The problems with an infection during a joint replacement is it can loosen a component and requires washing out and revision surgery, and it forms a biofilm which makes things quite difficult to treat sometimes. And it has a high mortality and morbidity associated with it. So it's an important thing to try and manage appropriately. As part of our treatment, there's lots of options available, but generally speaking, it's either washing out the joint or revising the joint to a new component. But looking at the literature, you can see that there's a lot of literature from around the world, most presenting with a handful of patients, from about 5 patients to 200 patients, so all small series patients, and all having widely varying outcomes and success rates in terms of treating joint infection. So why is this? And the reason behind it is it's a rare event, so even the biggest centers don't have many joint infections over a set period of time. And the way they present in terms of, say, their bugs are heterogeneous, the way they're treated are different from different places around the world. Timing as to when their infection is detected and to when they're treated is different prostheses, and there's different definitions around the world as to what constitutes success and what constitutes an infection. But we really do need to know how to treat these infections appropriately, and hence, it'll be good to find a way to find out what the best available treatment is. And looking at how we can best approach this, we need something that will to allow us to look at lots of centers with lots of data, preferably internationally. We need to be able to draw conclusions from this data, so remove some of the heterogeneity around the data, and we need to have something that's accurate and comparable. So, for example, using the same units, same timeframes, same definitions around the world. And what meets all these requirements is a registry. So how do we set up a prosthetic joint infection registry? Well, the first thing we needed stakeholders to be involved in this. And so what we did was we approached a number of different institutions around the world, all of which had previously published authors, all of which were shown to have a good track history of participating in research. And we had a late night meeting one night, and everyone agreed that a prosthetic joint infection registry was a good idea, and we agreed to proceed from there. So if you look at the map, we've got people from all around the world trying to encompass most of Europe, America, and Australia, with the hope that later on it'll expand to include, more of Asia and the other continents as well. So the next step was to make some decisions. The decisions we needed to make was what to collect, how to collect it, and in terms of how to collect it, in what format, how the data would be stored, where it would be stored, and then finally, once the data was stored, how to answer questions from the data. And then finally, how to keep it all fair and legitimate so that everyone feels like they're being treated fairly and are involved appropriately. So the way we approached this was basically a roundtable discussion. Every stakeholder had a representative that would come to this roundtable discussions, and we'd go through all these things, and I'll come through how we did that. So the first thing was what to collect. The thing we had to look at here was whether we wanted to have something that was completely complete, so comprehensive, or whether we had to look at something that would ensure maximal compliance from centres. Unfortunately, as we all know from research, the more data you try and collect, the less compliant people are in filling this data. So you can't have surveys that are hundreds of pages long, or else no one would fill them. The other thing was about accuracy and comparability. So we had to make sure that the data was collected was the same across all stakeholders. For example, in terms of when certain data points are measured, how they're measured, and what units are used. So basically what we did is, as mentioned before, a roundtable discussion going through what everything thought we might have to collect, and narrowing it down over a number of meetings to the things we thought were essential, i.e. the green things, and the things we thought would be useful, yellow things, to construct our registry. Then the next step was to construct a data dictionary. A data dictionary is basically going through each of those variables, finding a consensus definition for it, and if required, a unit value for it and a timestamp for that. And all of that took a number of months, but by the end of it, we had a consensus form of what data we were collecting, and a data dictionary mated to that form to allow accuracy. The next step was how to collect the data. So we needed something that was safe and secure, that would allow separate data ownerships for different centers, but allowed also the ability to combine the data when required to answer a question. And the thing we came to was Redcap, which is Research Electronic Data Capture System, which is a worldwide free database system that's available at most universities, which really fit this all of our requirements well. Redcaps basically allows you to have safe, secure data stored on a server, usually held at a university or a hospital, and it allows you to format the data to allow a form to be able to put data into the database quite easily. If anyone wants more information about Redcap, the University of Melbourne does have a Redcap website and is very much geared towards allowing people at the university to use Redcap. They've also got quite an extensive help desk, which will help. And because it's so widely used around the world, it's unlikely to disappear anytime soon. The other good thing about Redcap is there's multiple tutorials available throughout the internet, especially on YouTube. So it's very easy from having no knowledge about how to use it to being an expert on it in a relatively quick succession, just by going through the tutorials, which is what we did. So that we know what to collect and how to collect it, the next thing was the ethics. This is probably the biggest hurdle we faced. And the reason being was because we had multiple people around the world contributing data. There's a lot about how we'd keep it all de-identified and how we'd go about data ownership. And that required a lot of work with data sharing agreements amongst stakeholders and continents. And every continent had their own different bugbears that we had to traverse. So that took a lot of doing. And the next thing we needed was support, basically. So end of the day, this is an arduous task, and you need someone to be on top of it. And it's almost a full-time job setting the registry up. And to this effect, we recruited a PhD student, Elise, who really took the bulls by the horn and guided this big mammoth project throughout its ups and downs. And finally, governance is an important issue to think about. And what we mean by governance is keeping it all really fair and rigid with a good framework to allow people to know how the data is used and what to do if they have problems within the actual registry. And the way we approach the governance is, again, asking the major stakeholders to contribute a person and having a governance meeting. And during these meetings, we came about with solutions on how the data is stored, who owns the data, how a question can be raised, and how people contribute to that question. And finally, all about publication and authorship as to who ends up being the lead author, final author. Luckily, with big registry data like this, you can have a group as an author, which makes it a little bit easier to get around all that. So finally, nearing the end of it, it's all about branding. So we had to come up with a name, and name became the Orthopedic Devices Infection Network, ODIN, which is a nice sounding name, but that took a while to do as well. And we came up with a logo. So one of our medical students designed this logo for us, which we think is quite nifty. And we came up with a website to allow members to get involved, join, and have all the instructions on a website. So they've got it readily available. So finally, what we're hoping to do over the next year or two is start filling the registry with data and slowly using the combined worldwide data to answer some of those questions about prosthetic joint infections that we've had problems answering with smaller data sets. So watch this space. Thanks very much, and I'm open to any questions.